It's a traditional way to look at using medications in addiction treatment is medication-assisted treatment. So we look at that term and we say, is this really what's going on with the treatment? When we look at other diseases, whether they're behavioral diseases or psychiatric disorders like depression or schizophrenia, we look at hypertension or diabetes, we don't talk about medication-assisted treatment. The treatment itself, inherent in that treatment, is medication. So when we talk about medication-assisted treatment, it turns our mind in a different way with regard to how we're treating substance use disorders in general. So medication-supported recovery is not just a different term for using medications in the treatment process. It's really about thinking differently, about thinking about a different way to contextualize treatment as a whole. So when we're talking about treatment for addiction disorders or substance use disorders, medications are inherent in that process. They may or may not be, depending on the individual, but they're not a part of assisting treatment. They're just treatment in general. So we use medication-supported recovery because the goal for us here at Ashley is to get people into a place of good recovery, by whatever means that is. And medications, without a doubt, can be part of that process. So, again, this goes back to treating any disorder and using any means possible to treat that disorder. So medications do play a role in it. And why do we have to consider medications? Because they have proven efficacy. And when we're talking about medications like buprenorphine, we know a few very important outcomes that can be improved. One is increasing engagement in treatment. And the longer somebody remains engaged in treatment, the more likely they are to get into a good place of recovery. And besides that, it also decreases illicit substance use, opiate use, and it decreases all-cause mortality, so it saves lives. So to not have this as part of treatment or as an option in treatment is really not an option for us. The words do matter, but it's not just words in and of themselves. So we're not looking at just taking a term and using a different term. We are looking at actually thinking about this a different way. And that's why we decided to call it medication-supported recovery. It's not about using a more updated term or anything like that. It's about saying what we really mean when we talk about using medications in treatment. So for us, again, treatment is the goal. Treatment encompasses everything that we do to help people get into a place of recovery. And that can involve many things. Medications is one of them. And when we're talking about it, we're not just talking about medications to treat addiction and the FDA-approved medications to treat addictive disorders. We're talking about medications that help support recovery in general. So that could be any psychotropic medication or any medication that will help somebody get into a place of good recovery.